I just want to know why Steve got the Braveheart picture and I have like, I don't know.
I know people.
Yeah, all right, well, that's fine. We all need help when we can get it, right? So when I was asked to speak about the no one left behind and why that matters, I got to say, I was a little confused at first because I'm like, what do you mean no one left behind? Do I really need to explain that? You know, like, isn't that obvious? But apparently it may not be obvious. And so what do we mean by no one left behind medically? Well, first I would ask you to consider what are the other choices. So if you don't have no one left behind, that means we're going to leave some people behind? That doesn't work, right? In 2023 in New York State, what do we have, like 4,000 people, you know, that died of this disease, and that didn't work out too well. So I almost feel like no one left behind is the only option. So as I was trying to think of what to say today, I thought to myself, well, I don't want to get up there and be like, well, it's obvious. What's the matter with you guys? You know what I mean? So I'd come off like like a jerk. But the truth of the matter is, it's important that no one gets left behind because we've tried it the other way. It didn't work out too well, right? I think last year it was a couple of, like 300 people in Suffolk County, maybe a bit more, 330, died of this. So we've tried it the other way. It doesn't work that way. So when we say no one left behind, it doesn't mean, let's be the most permissive program on the island. It doesn't mean, let them get away with murder, let them get away with, no, it means making sure patients stay engaged. Because unless that patient is engaged, they're at tremendous risk of dying, okay? That's the bottom line. It's great to be a hard nose. It's great to be, hard-fisted. And yes, absolutely. At certain points, you have to have boundaries. No one left behind doesn't mean there's no boundaries, but you need to do it. On top of that, you can't just have a no one left behind mentality and then be like, oh yeah, but we don't have a psychiatrist to handle that. We don't have a counselor that specializes in this. So it's very important that if you're going to follow a no one left behind mentality, you got to have the infrastructure to make sure that you can. You have to be able to say when one of you guys call me, like, I've got this guy, he just got out of jail, he's, blah, 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 I never want the answer to be no. The answer should always be yes, unless it really is a matter of we do not have the infrastructure with which to take care of that patient. But as far as I'm concerned, as long as we can, we're going to keep that patient engaged. He may screw up. We all know this isn't a linear disease, right? The blood sugar doesn't come down regularly as you give the patient insulin. It's not the way it works with this one. You could do everything right, and then all of a sudden, that patient, passes the 7-Eleven that he used to get, and it's over. And now you have a week of fallback. So we know it's not linear. You can't leave anybody behind. And medically, I hate to say it, the literature is clear. Keeping patients engaged, the literature is even more clear about medication-assisted treatment. Seems to be a very excellent modality to keep people alive. I don't think none of us can argue with that. And so having that infrastructure to get that patient in, and of course, making sure that there's people like yourselves that give us an outflow if it's a patient that we can't take care of. And not every treatment is the same for everybody, by the way. So a patient that might do great at Victory may not do great at somewhere else. And a patient who doesn't do good at Victory might do great somewhere else. So it's really important that we work as a community to get this going. And probably most importantly, if a patient never heard of us or never heard of any of the other programs, they can't get help. They don't know where to go. Talk about loneliness, as Moshe said. Yeah. So you can't cut people off. You got to keep them engaged. You got to work with them. And it doesn't mean you let them get away with murder. There's a fine line. And truthfully, that's what makes it so hard. Like if it was easy, it'd be easy. We wouldn't even be here. Everything would be great. Oh yeah, bring them in, give them Suboxone, and let them see the counselor. We're all done. Not the way it works. Some patients don't do good, and we have methadone. Well, that's one of the points that Steve brought up, and I'll shut up now. One of the things that Steve brought up was, if we're going to do this, this is not an easy thing to do. So you got to have all the different modalities, and that's where the Bentley came in. You want to build something that can really take care of everybody. So that's the no one left behind from a medical perspective. There is no other choice, quite frankly, and it's not 1980 anymore. And I like to end with this since everyone's bringing up quotes. So one of my favorite things is the 3 phases of truth. And I don't know who did, Schopenhauer or someone, some German philosopher. So first, a truth is ridiculed. Oh, that's ridiculous. You're just going to let patients come in and you're going to test dirty and you're not going to throw them out, right? So it's ridiculed. Then it's violently opposed. Well, it's opposed, sometimes violently, but not necessarily. Oh, this is ridiculous. There should be a law about this. You can't let these patients stay in and continue to treat them. And then finally, the final phase of the truth is it's regarded as self-evident. I thought we were at the regarded as self-evident phase, but maybe we're not yet, but we'll get there. And so that's what I'll leave you with. I hope soon we will be at that final phase of truth.
Yeah.